question. Basically, this is more a billing question. If the doctor performs at the hospital as an outpatient procedure of bone marrow, which is code 38221, can he add an E&M code along with a modifier 25? This is a Medicare established patient. He is a hematologist oncologist. Alicia, can my slide go up a little bit, or I can just read it? Okay, thanks. Okay, the code we are speaking about in the code descriptor is 38221, which is bone marrow biopsy, needle or trocar. A needle is inserted through the skin and advanced until the bone is actually penetrated. Then a small chip of bone marrow is removed for biopsy by a trocar or needle. This code can be used only once a day. There are a few times when you would need to do it more than once a day, but it is a once-a-day code. I want to talk about modifier 25 a bit, and I've learned so much about modifier 25 through the Blitz videos with Laureen. But it is a global package modifier. It's used if there is an E&M on the same day as the procedure, and that E&M is for a significant separate service. So you can't use it as a modifier for an E&M for like a decision to perform surgery. This is not happening here for a scenario where the patient is coming into the hospital to have an outpatient procedure done. When a patient does go into the hospital for that, usually an E&M is not performed. Now, you don't usually put an E&M on an outpatient procedure. It's just not usually done, because if the doctor comes in and sees you before the procedure, usually he's just looking, yeah, okay, everything's cool. It doesn't constitute an E&M. Now, if the doctor came in and he looked at you and you were having some kind of reaction that didn't seem normal, or you were sick, or your temperature was, 105, he may need at that point to evaluate you. And if he does, then of course he can be paid for that, because it's a separate thing. He's looking at, what's going on right now, and maybe we shouldn't be doing this procedure today. Okay, in that case, you can use that procedure. Can we scroll up a little bit?
There you go.
Okay, great. Basically, procedures do have built into them a quick overview of the day of the procedure. But like I said, if there's a huge worsening of symptoms, or they're having new symptoms, then that is another issue and we could use it. The main question remains, was a separate identifiable E&M service necessary and performed. If the doctor just came in and said, hey, you're good to go for the procedure today, then it's included in the global package. Remember, the global package includes pre-op, the procedure, and post-op. Now, if the person the day of the surgery had a situation going on, like we said, a big exacerbation of symptoms or a problem that may interfere with the procedure, then an E&M would be warranted. You would use your modifier 25. You have to be careful about billing too many E&Ms in a day. And also, this procedure code can only be reported once a day.
Yep. That's all good stuff.
Seems like modifier 25 is coming up a lot tonight.
Yeah, really. I like that 105 temp. Yeah.
You're going to be
doing a procedure today.
We're not doing the bone marrow today. We're going to get the temperature down.
Thanks, Dawn.
Thank you, Dawn. Another little thing that I share with my students for modifier 25 and E&M, to really visualize you having a procedure note and then a separate significant E&M note. And that's really what 25 is saying. So I'll say you can't bill an E&M unless you have a HEM, meaning that you can clearly see a history exam and medical decision making. Then you can feel comfortable reporting it and not getting in trouble.
So Dawn is the instructor and coach for our billing course, and she is real savvy with billing. So I've asked her several questions with billing. Thanks, Don.
Thank you, guys.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.